Hello and welcome. My name is Johannes Fisslinger, founder of Lifestyle Prescriptions University, and welcome to our webinar training. It's all about how you can find the root cause emotions and stressors causing over 1,000 symptoms very quickly. It's all based on the body-mind social connection, on what we also call the psychosocial root cause analysis, and especially the art and science of self-healing that we teach here exclusively at the Lifestyle Prescriptions University. Now, before we get started, a few housekeeping items. Have some paper and pen ready. Make sure you take the time to really listen, because you're going to learn so much. They're going to give you so much value, things that you can integrate right away into your practice, into your life. So maybe turn off your phone, no distractions, and make sure just to stay here with me in about 35-40 minutes or so that the webinar will take. And also at the end, I'm going to give you an offer that you absolutely going to love. Something that I know is of tremendous value. So again, in about 35-40 minutes, that's when I give you this information. Now, also on the right side of this window, or I think on the mobile it might be at the bottom, you have an option for chatting. You can type in the chat box and comment and ask your questions. And at the end, I try to answer all of your questions that you have. Now, to get started, what I'd like you to do is, first of all, say hi, hello, how are you? And I'm sure you can hear and see this. All is good technology-wise. Also type in where you're from, because I'd love to know where you're from, because our students come from all over the world. And in a minute, there is a pop-up survey. Basically, I'd like to know, are you working in traditional medicine, complementary medicine, energy psychology, any other health professional or coaching area, or if this is just for you because you're interested to heal yourself. Okay, so just on the right side, you should see this pop up right now. And if you just spend like 2-3 seconds to just select which area you're working. Now, what we want to talk about today is about a revolutionary new healing paradigm, which, some of our students call it Louise Hay on steroids, or mind-body connection on steroids, which basically means it goes way beyond what we used to know about the body-mind connection. It's way deeper than that, more precise than that. And that's what I want to share with you. But we want to start with, basically the science that pretty much shows us now that up to 90% of health issues, of all symptoms that we may experience, have an emotional or stress component. Now, in this webinar, I want to show you the art and science of self-healing. We're going to talk about the 3 most important questions that you can ask your clients. And we're going to talk about lifestyle prescriptions and root cause analysis, all based on the body-mind social connection, or the organ-mind-brain social connection. Now, I want to make sure that this is for you, right? I want to make sure that you get tremendous value and this webinar is something that you can benefit from. So if you're working really in any health professional field, if you're a health professional therapist, then this is creating a new foundation. You're going to learn something that you can integrate right away. So stay here with me for the entirety of the webinar. Especially if you work with EFT, tapping, NLP, hypnotherapy, energy psychology, or as a health coach, and use somehow the body-mind connection already, work with quantum or energetic medicine, holistic medicine, integrative, functional, lifestyle medicine, then this is absolutely a must. So you are at the right spot at the right time here. Now, we all experience challenges, right, in our work. We all want to improve, we want to get better, and we want to be more confident, more competent, and create better results for our clients. And I want to address 4 of these challenges that we hear again and again from our early students when they come. They say, well, we're so interested in learning more. Can you help here? The first one is the why. I can't answer the why. which is basically somebody comes to you, and let me give you an example, right? Somebody comes with Crohn's disease, diarrhea, abdominal pain, chronic for many years, and tried everything, and just nothing seemed to improve, right? But then the client asks you, why is this? Why did it start 2 years ago, right? What's the cause? What's the root cause here? Is it just something broken, like pathology, right? Something's wrong, we need to fix it, operate it, or whatever it may be. Is it nutrition? Or is there more? Are there emotions at play, stress, our thoughts, right? And is there a timeline? Why is it chronic? Sometimes it's really bad, sometimes it's actually, the symptoms seem to be disappearing. And I feel okay and I'm happy, and then a few days later it seems to come back with a vengeance. So what's that timeline? What's that process that is happening? Why do symptoms change? These are a lot of these questions that people have, that we as health professionals have, and our clients have. And I can only tell you from the experience from our students, which, by the way, there are doctors, naturopaths, all types of health professionals study the art and science with us at the Lifestyle Prescriptions University. And what they say is, once I, as a health professional, are able to answer the why. A client asks me, why do I have Crohn's disease? Why do I have back pain? Why did it start 2 days ago? And why does it disappear? Why is it chronic? Why do I have eczema? It gives us so much confidence and this ability to answer questions that clients have. Now, not only from a biology or physiology or body or organ perspective, but from a body, mind, social, from a holistic, integrative perspective. The second challenge that we hear again and again, if we know already that emotions and trauma affect our clients' symptoms, but it's just difficult, or I don't know exactly how to find the specific emotions, because we know by now it's not just a random. It's not just I'm angry and my whole body is angry, actually, or is affected. Actually, it's way more specific than that, every organ tissue specifically in our body is affected by very specific emotions, stresses, beliefs and thoughts and life situations. And I'm gonna go there obviously in a minute. I want to help you to resolve these challenges. That's really our core mission, help you improve and become absolute experts and masters and specialists in lifestyle prescriptions, root cause analysis, and the body-mind social connection, and art and science of self-healing. Now, let me give an example. So somebody comes to you with lower back pain, chronic for 2-3 years. It's on the right side, L2, L3 area. And again, the client asks, well, I just, my nutrition is wonderful. My life is actually pretty good. Why do I have this suddenly for 2-3 years? And why is it chronic? Why does it change, right? And what results can you give me? How can you help me with this? And we want to be able to answer these questions with confidence and competence when a client is asking us. The third challenge that we get again and again is I don't get consistent results and I don't feel fully confident. And obviously it's a life's work, right? It's sometimes it takes us many years to build up that confidence and competence and get more consistent results with clients. Like having this feeling inside of us that whoever comes to us as a client, I'm ready. I know how the body works. I know what the root causes are, and I have the tools and the skills to help my clients. That's our mission here. Let's take a look at some of the more serious health issues, which breast cancer is considered to be more serious. Obviously, it's one of these symptoms that there's a lot of fear attached to it, a lot of confusion. Why is this happening to me? And what's the cause? What's the emotional impact, the stress impact, and so on. And so I'm going to go there in the second part of this webinar. I'm going to explain what is the root cause, what's the self-healing process, why actually are the breast ducts, the breast duct symptoms, the carcinoma in situ, why is it part of the repair phase, the regeneration phase, and not a stressful situation that I experienced? So more on that here in a minute. The fourth challenge we hear a lot is about well, I'm using nutrition, I'm a nutritionist, I use lifestyle medicine, integrative medicine, I'm getting great results, but especially with chronic symptoms, they improve, but often they do not disappear. So I want to integrate the mind, the body-mind connection, stress management, and how do I do that best? How do I help my clients best? And that's where the art and science of self-healing comes in. Now let me quickly pre-frame what we mean when we talk about the art and science of self-healing. Just imagine if there's nothing wrong with you or your clients. The symptoms are not a problem. They're not an error. There's nothing at fault, but actually it's our body's healing intelligence at work. It's our body adjusting to life situation. Our body is constantly auto-regulating. It's auto-regulating and adjusting to life. So depending on how we perceive life, depending on what life situations we experience, our body adjusts, and symptoms are the signs of that adjustment. Now, if we look at it from that perspective, that every organ tissue goes through very specific points and phases of self-healing. Every organ tissue has very specific emotions and thoughts and stressors. Then we can treat the root cause. Then we know where to look because we have a pattern, we have a system that is very easy to use, but shows us especially where to look and which blockages to remove. Now, I'm sure we all agree that we want to treat the root causes. We don't want to just mop up the floor all the time, but we want to find out what's causing this mess on the floor, right? What's causing these symptoms down here, which in this case we turn off the faucet and the symptoms start to disappear. The why is absolutely important. If something is wrong with our computer or something is not working in our car or cell phone, once we know what the why is, we can fix it, right? We know where to look. We know that we can often just make small, minor changes and the system goes back to normal. But this is only possible if we look at our body-mind social connection or the organ-mind-brain connection at the big picture. And if you look at biology, consider your body, your body-mind social connection, because we cannot separate ourselves, our body and our mind from our environment. Consider your body the seat of consciousness, that everything that happens in your body is a direct reflection of consciousness, that every symptom is a signpost, and the more we know how to look and actually being able to decode our symptoms, the easier it is to use our technologies and methods and modalities in a much more effective way. So, what is that body-mind social connection? Well, actually in Lifestyle Prescriptions here, the way we teach, we are way more specific, right? It's not just a body-mind social connection, which is kind of generic, but it's actually a very specific organ, stress, emotion, belief, social lifestyle connection. What does that mean? Well, it means that every organ, actually specifically organ tissue, and organ tissue, what we mean by that, the liver has several different types of tissue. The gallbladder ducts inside the gallbladder, the liver parenchyma, the skin has the skin epidermis, the outer skin, and the skin dermis, which is the thicker leather skin below the epidermis. So we have to separate, we have to know which organ tissue is affected, because every organ tissue in our body is affected by different, very specific stress triggers, which you also could call them conflicts, traumas, highly emotional events that trigger different organ tissue. Different emotions are affecting these organ tissue, and beliefs and social conflicts or lifestyle situations, habits. So once we see that the body is way more specific and we integrate that into our work, suddenly we can find the needle in the haystack because we know where to look. We just go there, take that needle out, and oh my God, the body, the stress, this sympathetic primal system in our body, the autonomic nervous system, starts to regenerate and repair itself. So I'm going to give you a couple examples in a minute. The second principle, which is here in the middle, is about the timeline. It's about the major points and phases of self-healing, and how not just our body in general, but how every organ tissue in our body autoregulates. There's a constant process going on between stress repair. It's kind of a little bit this yin-yang kind of principle, where we are triggered by a specific stress trigger here, number 2, into the stress phase. That stress phase means we are sympathetic, the autonomous nervous system is under stress, our body is under stress, that specific organ tissue is in the stress, it shows specific symptoms, it has very specific emotion like anger attached to it. For example, let's take an example, the skin epidermis, the stress trigger would be a loss of touch. This feeling of I cannot touch someone, I lost someone, I lost a loved one, there's a separation, and so on. I go there in a minute and show you a diagram. The emotion could be anger, because I'm really upset about this and I'm thinking about it all the time. I have now starting to develop a belief about that loss and the need for connection. There's a social situation, I have experienced a life situation that caused me to react with that skin epidermis eczema type of reaction. And obviously lifestyle plays a major role. Now, in the regeneration phase is basically we fall into regeneration when that stress situation is gone. Many different ways how that can happen. But when the stress is lower or gone, then our body says, well, that stress is gone, thank you. Now finally, I can repair. The body goes into parasympathetic regeneration mode, repair mode, and wants to repair that specific organ tissue, the skin epidermis. Now we have different symptoms in the regeneration phase. We have different emotional state, our thoughts are different. But basically our body wants to go back to that healthy state, but needs to repair the damage that has been done really in the stress phase. Now we call this cycle, there are 9 specific points and phases that our body, or actually every single organ tissue, goes through. So it's not just our body going through self-healing, but every organ tissue has different symptoms on an emotional level, physical level, and thought level that it goes through when it goes through these 9 points and phases of self-healing. Let me give you an example. This is the skin eczema. Now you see here a cutout, an excerpt from our charts, the organ, mind, brain connection charts. Again, think about Louise Hay, but about 1,000 times amplified and based on biology. So this is not our mind, or it's not positive thinking. It's not really the conventional body-mind connection, because this is about biology. Our emotions and thoughts are directly linked to our body, to our organ tissue. There's a reason why we have certain organs. They're not just there for fun. I mean, they're there for fun, but you know what I mean. They're there, they have a purpose. There's a biological function, a purpose of every single organ tissue. We have a stomach to digest, and I give you a big picture here, right? We have eyes to see, and we have the skin epidermis to feel, to touch. It's not a protective organ, right? The protective skin is the dermis skin. So that's about protection. The skin, the outer layer, this thin layer, is about feeling, touching, kinesthetically connecting with people. It's a social type of organ tissue. Now, if we experience a traumatic event, as I said before, a loss of a loved one, a child goes to school or goes to college and we can't feel, touch that loved person anymore. That's when usually our body, the skin epidermis specifically, adjusts to that life situation. And the interesting part in the stress phase, we feel that stress. Oh my God, why is he gone? We think about it all the time. You're very, very sad. 0 to 10, it's a 12, right? But in that stress phase, our body, the epidermis skin is number. It's dry, rough, flaky skin here, right? Which basically means the body's helping us. We're feeling a little bit less. Our body's actually adjusting to that situation. Now, at the moment when we feel that stress is gone, we go into regeneration phase. That's when we are hypersensitive. That's when we have inflamed, swollen, eczema type of skin or similar type of symptoms. Now, this is about the timeline, right? If we know what the timeline is, then we know where the client is. If someone comes to you with eczema, just started 7 days ago, you know they are here. They know they are in the regeneration phase A. 7 days ago was the regeneration trigger. Before that was a stress phase, probably for 7 to 10 days. And then 7 to 10 days ago, there was a stress trigger, a specific trigger that triggered me into being sad, feeling this loss of a loved one, and my body reacted with symptoms. It's this process of self-healing. Now, the skin dermis reacts very different. It's more a survival type of, or protective type of skin. Now imagine this client comes to you and has skin symptoms. Do you know which skin tissue it is? Epidermis, dermis? Well, there's a few others, right, which I don't want to go into right now. Do you know what the conflict theme is? Just imagine if you would know that. A client comes to you, you ask maybe 2-3 questions, you know the symptom. You ask 2-3 questions and you know how they think, you know what thoughts they have, you know how their organ tissue reacts, you know what the organ tissue is, you even know the brain connection. You know, is it a social, is it a survival issue, is it a self-worth issue? You know how the body reacts, you know the art and science of self-healing. You're able to decode your client's intelligence, and that makes you so sharp and so precise in your root cause analysis. Another example, we talked about the back pain, right? So that's one example that I had many years ago. It was horrible. I felt so bad. I didn't know what it was. I tried traditional, I tried complementary alternative medicine, I tried everything. I tried yoga, which improved my back pain, let's say 50%, but I always felt something is there. And we have many clients with these similar symptoms. If it's lower back or if it's shoulders, whatever it may be in the skeletal system. The skeletal system, let's take the bones, right? If it's a bone issue, the stress trigger is a self-devaluation. I'm not good enough, I'm not strong enough, are the beliefs that are associated with it. We can find it every single time. The emotion could be anger, could be other emotions too, could be guilt, depends on that person's subjective perception. The social situation, it might be, having a very stressful job and just putting a lot of pressure on you because you have to finish something. It could be a relationship that is just feeling emotionally overloaded. You just cannot stand it. You don't have the strength to deal with that situation. Now, obviously, in our body, it totally depends the meaning of that symptom. Is it in the lower back? Is it the hip? Is it around the ribs? Is it the head, right? Is it the shoulders? Are the fingers, hands, knees? All that has very specific meaning. And it's not kind of intuitive approach. It is a very specific biological approach. It's what is the biological function or purpose of that organ tissue. Crohn's disease, it's all about indigestion. So small intestine, it's about the small intestine. The conflict theme or stress trigger is a survival anger indigestion, which means I experience something that makes me really angry. I kind of think about as this situation as kind of really severe. It's about survival. Survival for me, my family, or often financial situation. It's something I cannot digest. Our digestive tract is not just about digesting food. So food is important, lifestyle is important, but it's about digesting emotions, thoughts, life situations, traumas. And if we as health professionals are able to find out where's the root cause here, is it just lifestyle? We work with nutrition. It improves tremendously, but there's still something there. It does not go away. It's still chronic. Well, then we have to look at the stress triggers, at the emotions that are there, caught in that small intestine, the belief patterns and the social situations. And once we know which of these root causes do we need to address, again, it's like finding the needle in the haystack, and we pull it out, we remove these blockages, make lifestyle habit changes, use our modalities, and it's incredible how fast our body has the ability to repair and to regenerate. Now, with breast, we have two main patterns that we see. The breast glands, which are about worry or fight, which is, I think, about 20-30% of the breast symptoms are in the glands, or the breast ducts, about 70 or so percent, which is again about this nurturing loss or separation of a loved one. We've seen it again and again. It usually happens with relationship separations, divorces, losing a child, or these kind of very nurturing. It's not so much about the skin, which is about physically touching. This is about nurturing. It's about supporting and having this nurturing, loving feeling towards someone that is very deep, and that is usually affecting the breast ducts or the glands. Now, the beautiful part is that we can see these changes with like thermobuzzer, which is a technology we also offer, thermobuzzer mobile thermography. We can see these shifts and changes in the autonomic nervous system, in our whole body, especially the breasts, many years before there is pathology, many years before symptoms are there. And once we know, we make the lifestyle changes. First of all, we know what the root causes are. What are the emotions, stress triggers, beliefs that trigger this process? We make the changes and our body heals naturally. It's absolutely amazing to see these changes. Now, one thing I wanted to briefly mention, which I want you to think about. Why is it that many women that are diagnosed with carcinoma in situ, many women actually feel like they're doing really well. Their life is improving. They have maybe a new relationship, right? They feel like, I don't understand why I've been diagnosed with this carcinoma in situ, which is basically an inflammatory process. It's not really a cancer. It's an inflammatory process in the breast ducts. Now, think about this. If we can find out the root causes early, make the necessary changes on the body, mind, social level, oh my God, just imagine how much pain and confusion and fear and suffering we can prevent. Let me go to the 3 most powerful questions that I feel you can ask your clients or yourself. Now, consider this again about the organ-mind-brain connection, about biology. The first one I want to encourage you is to really be more specific. It's not just, well, it's the liver. No, well, what part of the liver? It's the eyes. Well, is it vitreous body? Is it retina? Is it which part of the body is it? Now, having a proper diagnosis is ideal, or if that's not available, intuitively ask your client, check with your client to be very specific which organ tissue is affected. And then ask this, what's the biological purpose of that organ tissue? What's the biological purpose of the epidermis skin? It's about feeling, touching. What's the biological purpose of the skeletal system? It's about, the purpose is, or the function is, to stand up straight. It's about self-value. It's about being strong, being straight, having value, feeling valued inside of yourself. So every organ tissue has a very specific function, physiological, biological function or purpose. Once you know that, you know what the stress triggers, you know what the conflict theme is, you know what type of life situation has affected this client. And then you check, well, how can that be resolved? You use your modalities, right? You use habit change. You ask the client, well, how can you change that? If you know now, that is what's connected, that's what's triggering your symptom, well, then the client makes the connection, which is absolutely amazing. Some of our doctors, they use our charts, right? They have it on the wall and on their desk, and a client comes in, they have 5 minutes, right? They don't have much time for clients, but they feed back, well, have you experienced some separation anxiety or loss of someone before the symptoms started? Well, and they say, yeah, how do you know? Well, we know our clients so well because we know how our body works. We know the art and science of self-healing. And it's amazing how much this aha moment that clients experience when they start to know the why and the root cause. Now, the question I see in the chat box here also, and we always get, well, how can you study this root cause analysis? How can I increase my confidence and be more precise, way more precise in finding the emotional stress triggers and the beliefs and thought patterns that affect very specific organ tissue, and in turn be more successful, have more results, have more clients, word of mouth marketing goes up, right? Because people say, wow, finally someone that knows what they're talking about, they answer my questions very precisely. Now, until last year, actually until this year, we only had our 12-month lifestyle prescription health coach certification training. And we decided for the first time, for a very limited time and a limited amount of students, make the first 3 months, which is about the root cause analysis, about finding these root causes, available to everyone. So for a very limited time, we have this 3-month root cause analysis training available, and it's focused around exactly solving the 3 or 4 actually, or 5 challenges that we talked about. It's about being able to answer the why, being able to find the root cause emotions, stresses, beliefs, and lifestyle habits very quickly to get consistent results, right? And have strong, feel really confident no matter which client, which symptom appears. To improve your skills, meaning once you know the art and science of self-healing, your skills go up. I mean, your results go up. Your modalities, you're going to use them so much more effectively. And especially with chronic issues, you have many options. You are able to know which area, where's the blockage, and you are able to pinpoint and find that needle in the haystack and really resolve chronic issues. Absolutely amazing how fast this can happen. Now, as I said, for a very limited time, we offer you actually something totally amazing, which is 50% off of our brand new 3-month Lifestyle Prescriptions Root Cause Analysis Training. Now, this is 3 months of live classes. We're doing this basically because we are so passionate about this art and science of self-healing and lifestyle prescriptions that we feel we need thousands and thousands of health professionals knowing this. We need you to know this, because if you know, then you change your client's life, you have tremendous results, you increase your practice, your business, more clients come to you, word of mouth goes up, and that is how we change healthcare towards a preventive, root cause, and self-healing based system. So we have thousands of practitioners already, but this needs to be a mass movement. And so we need you to be involved, to be a leader, to step up and take this next step. And this 3-month root cause analysis training is the perfect next step because it's very affordable and you get such tremendous value. Now, what do you get? And by the way, there is a link already on the right side, or a little image, an offer popped up that shows you the link where you can go to register. Now, this is limited, right? So they just, I think 11 or 12 units are just, spots are just available. So if you want to make sure to get it, click right now. While the video or the webinar continues, you can click, a new window opens up. Click either choose from one of the 2 payment options and go through the checkout process while you continue to listen here for the webinar. So what is included in this 3-month root cause analysis training? It's all about the organ-mind-brain connection, to learn about the milestones of self-healing. Where is the blockage? Which of these root causes do I need to address? You find the root causes very quickly, and of 1,000 plus symptoms. You know how to spot and use the major points and phases of self-healing. This alone is invaluable. We teach you a 10-step root cause analysis process that you use. Very simple. It's asking a few questions, and once you study, you actually, after like about 4 weeks in the training, you can use this with clients already. So it's very easy to apply, and you get better and better as you go along. And we give you our really absolutely amazing 13 charts and 5 posters and lifestyle prescription paths, this organ, mind, brain charts that just make it so easy. You look it up and know exactly what the root causes are and the symptoms and the stress and regeneration phase. I show you an image in a second and tell you more about the charts in just a minute. Now you might ask, well, do I have the time, right? Well, you absolutely do, because only 60 hours of study time. A lot of the study or the work is with clients. You integrate right away what we show you, what we teach you, the protocols and the steps with your clients. So it's very easy to do, to integrate this. It's 12 every week. We meet live online wherever you are around the world. You can participate through PC, smartphone or tablet. Very easy to access. It's a video, audio or chat call. We practice, we really show you how to do this. So this is not theory, right? This is something you integrate into your practice. We have excellent scripts, worksheets, and protocols that you use, so it's not like you have to write down everything. You just use what we have, use our script, and then improve as you go along. You have a very supportive Facebook support group of doctors, naturopaths, energy medicine practitioners, energetic healers, health coaches, right? There's an amazing group of practitioners that are very supportive. You have a question, a client comes to you tomorrow and say, what is this? Please help. Type it in. I bet you're going to get a response within like a few minutes. You also get continuous education unit points, CPD or CE point, that count pretty much all over the world. So you can also use them for continuous education. What our students say? Well, we have, again, thousands of students with the different courses that we offer, and I just want to, Joe's here, which I just love. She says, I love Lifestyle Prescriptions. It's revolutionary. It assists me in understanding both my own healing journey and that of my clients in a super fast way, life changer. I could give you many of these testimonials, especially our last health coach training. Absolutely wonderful group of health professionals, and they just absolutely love it because they get results. They get to the root cause quickly, they get results, and that's what our clients love, obviously. So this is, you can also check on the website more if you like, but then our students use it, and it's doctors, again, it's all types of health professionals, health coaches, energy psychology, nurses, doctors, chiropractors. They use lifestyle prescriptions and the root cause analysis process very effectively. Even if you don't have much time, like Dr. Jan here, he just has 5-10 minutes per client, but still uses it in a very profound way. So this is what we can offer to you right now. This is only exclusive for this webinar. So this offer is not available anywhere else. So take this advantage, right? Take advantage of this. The regular tuition for the 3-month is $1,997, $2,000 basically. You get a $1,000 tuition credit, that's US dollars, right? And so your tuition is only $997. Think about this, 3 months of absolutely amazing training, and you can integrate it right away into your practice. We also offer a payment plan. So you can even stretch it out over 4 months. So it's only $299 down. You can order that right now, register, click the link on the right side. I put it into the chat box, but there's also an order button there, like click here to register. And you have this option between the one-time payment or the payment plan. In any case, you register, you get right away access to some of our courses, and you can start right away. And what we even add is, because we want you to be happy, this is something we're so passionate about this. We want you to be happy, to be totally satisfied, right? And say, well, this is really going to help me. I'm getting tremendous value. So you can even try it for 7 days. You say, well, there's nothing for me, it doesn't do any good, it doesn't make any sense to me at all, then just let us know. We absolutely fund you anytime. But click the link here on the right side and order right now. And I'd like to share with you something additional, because we actually adding 3 major bonuses that you get, and they're valued at 1,173. So huge value, which is the foundation course. So you get instant access. You register right now, you get instant access, and you can start right away. The foundation course is wonderful because it's small chunks. It gives you like the basic information in small video clips, and you can, it's 40 course units that you can go through, and it's a great foundation for the 3-month health coach training, which is going to start actually very soon. You also get the organ mind brain connection charts, 5 posters and 13 charts, and the pads, the lifestyle prescription pads, so you can write lifestyle prescriptions, which is not about X medication, it's about lifestyle modifications. You write down a lifestyle prescription and give clients very specific homework or very specific habit change tools that really, they take that so wonderfully. So that's in the foundation course. We talk a lot about lifestyle prescriptions and how to write them, how to use habit change techniques to change your clients' lifestyle habits. You also get the mental health teleseminars, which we use in the course, and you can reference them. Lots of information about the organ mind brain connection and root cause analysis. So tremendous value. And we also give you an option to continue with the lifestyle prescription health coach certification training, which is basically right after the 3-month. It's another 9-month. And obviously you sign up right now and you have 3 months to think about it. And if you want to continue, just let us know and we work that out. So about the charts, you see there are very nice, beautiful charts about the different systems in our body. And you basically find right away, you have a symptom. Let's say the eczema example, you go there, look at the skin, you see right away there's different organ tissue, you know what the epidermis, conflict theme, symptoms in the stress regeneration phase. So it gives you all the essential information in these easy to use charts. So learning and integrating this into your practice is super fast. And obviously you get lifestyle prescription pads also with that. So tremendous value. And what we want you to become is a master in body, mind, social root cause analysis and the art and science of self-healing. And obviously this is very limited. It's just for the webinar, as I said, and there are only 11 spots. I think we had 12, but one was already gone a minute ago. So 11 spots available, and this offer is available for just a few more days. So it will absolutely go away because our training is going to start very soon. So now is the time. Now you might think, I'm not sure. Well, try it. Just register. You have 7 days to think about it, and start with the course units, with the foundation course. And I know that you absolutely gonna love it. This is it's easy to apply, easy to integrate, but it's gonna move your practice to a much different level because you focus on the art and science of self-healing and find these root causes very, very quickly. So let's go to questions. Let me check the chat box here. And oh boy, a lot of questions. So I hope let me check here the ones. Okay, here we go. Charts, if they are available separately. No, they're actually not. And by the way, these charts are sent by you by mail. These are hard copy, beautiful, very durable charts that you're gonna use with your clients. It's not digital. And the reason is because we just find it absolutely important that you know exactly what this information is and that you're able to use it in a profound way. Because there's so much highly valuable information on these charts and you need to know how to read them, how to apply them. And so we do require a training and I think once you get the charts and start learning in the foundation course and the 3-month training, you know why. Now, another question is, well, I'm rather new. I just started to use some techniques or learn some techniques, and is this still something for me, or is it only for doctors or naturopath? No, absolutely. I would say in our trainings we have about 20-25% traditional medicine, about 25-30% complementary alternative medicine practitioners, doctors, naturopath. We have about probably 30-40% energy psychology practitioners, and many health coaches that also start new. So this is absolutely perfect, and you start new at a very high level, that you get results and just know the body biology and how our self-healing works very, very quickly. So it's absolutely perfect if you want to start a new career and just change into something that you're really passionate about. Our whole network of faculty and students are very, very passionate about helping clients and really making a difference in people's life and changing healthcare. So yes, absolutely possible to start new. Breast cancer can't be only emotional. That can't be true. It's kind of, I think I'm paraphrasing the question here. Absolutely. Now, again, this is not about, well, it's just emotions, right? It's just our thoughts. It's all interconnected. Actually, let me say something here. As much as our body shows symptoms, right? For example, breast inflammation in the breast ducts. Our emotions are really symptoms. Our thought patterns, about 80% or something like that of our thoughts are automated. They're not conscious thoughts. So whenever we experience unconscious emotions, unconscious thoughts or beliefs, there are symptoms. There are symptoms of our body, a specific organ tissue, going through the 9 points and phases of self-healing. So with the breasts, there is a stressful traumatic event that life happens and our body adjusts. If it is about nurturing, losing someone that we feel like we want to nurture, or we are very connected, loving connection, and there's a traumatic loss, then it's possible our breast ducts react with physical symptoms. We have emotions, let's say, of sadness. We think about that loss all the time. These are typical symptoms on these 3 levels. In the stress phase, in the regeneration phase, our body repairs. The physically, we have more an inflammatory process in the breast ducts. Our emotions might be gone, they might be dormant. Also, the conflictive thinking is dormant because our body puts all the energy into repairing. Now, again, this is highly valuable if you know where the client is. So no, it's not just emotional, it's not just thought, it's not just body. We need to stop thinking about a unit. Our body is a unit of body, mind, social. It's an organ, mind, brain, social connection. And every organ tissue goes through a very specific process of self-healing, which we call these 9 major points on self-healing. We just need to know where to start, to find the root causes and to help our body to go back to this natural ability of autoregulation and self-healing. Next question. So nutrition is not that important. Oh, absolutely it's important. Absolutely, we know nutrition works. There's tons of science out there. Though nutrition can be very confusing, right? There's also, I think, almost like an overkill that, we can't eat anything anymore. And you probably have experienced that. Our practitioners, health coaches did, and all of you probably as health professionals know, you changed nutrition, you improved it, and symptoms start to disappear. Often they come back. Often they don't disappear completely. Even someone that has the absolute best nutrition might develop symptoms, or we do. And so the question is, what's behind that? What's triggering these symptoms, even if we have the perfect lifestyle? And that's what we want to look at here. Go beyond, look at a deeper level, basically, a deeper level of root causes, where lifestyle is one of these root causes. Viral infections, bacterial infections, oh boy, that's like a deep subject. Very controversial, because whenever someone would say, like we do, that the viruses, the bacteria, the microbiome, they're an absolute important part of our body's self-healing process. Without our viruses, without a bacterial activity, without the microbiome in our body, we could not repair, we could not even live. The question is it a pathology? Are the viruses causing health issues, or are they part of the self-healing? Are they part of an increased metabolism that's going on in our body? It's like, right, when you have firefighters always show up when there's fire. Are they causing the fire? No, they're part of the process. And so we need to have a new look at microbiome, and luckily there's a lot of research been coming out lately that kind of verifies the way we look at the importance of having a healthy microbiome in our body. Another question is, I'm from India, can I still attend? Yes, absolutely. Wherever you are in the world, you can attend. This is, you just use your tablet, your smartphone. We have a great, very reliable online video study platform that we use. We have all the materials, even if, let's say, you can't attend, or you want to just replay the different video classes. We have a very nice, very well organized student portal. You log in and just have all the study materials available, and you can check them off if you've done them, and just come back anytime. There's unlimited access, lifetime access to our trainings. So very easy. We managed it very well, so it doesn't take a lot of time on your end, but you study. You can actually, we have an app also where you can download the audio or PDF files and study wherever you go, in the train, in the car, where you drive, in the plane, wherever you are, and really integrate this self-healing, a new paradigm into your work. Okay, so I think there's a few more questions. Let's see here. One maybe about the training. So basically the question is, can I continue afterwards? I decide within 3 months if I continue for the health coach training. Yes. So yes. So basically you book the 3-month root cause analysis training. We call it level 1. If you want to continue to a more advanced training, you just talk to us, and we give you an amazing offer too, as a current student, to continue. But for now, I'd like you to focus just on the root cause analysis 3-month training, because this sets you up for root cause analysis, like finding the root causes and really changing the way you think. I warn you, there's a little warning here for you. In this training, we're going to change the way you think about your own body. You're going to experience your body different. You're going to experience, suddenly when you have symptoms in your body, you might look at it from a very different perspective. Just for me, what I can say, like whenever I have symptoms, I start to be like very curious. Oh, this is interesting. Where is this coming from? Okay, let's look at the root cause. Let's look at the organ tissue. Which organ tissue is it? What's the biological function, right? I look up the charts, and I start to totally realize, oh my God, this happened about a week ago. This happened, this is how I felt. And I didn't realize that this life situation, this emotion, this specific emotion and stressor, and belief, the thoughts that I have, affects this specific organ tissue. And it's this aha moment is just absolutely astounding. And I really wish for you to have that. And what happens, the fear of something being wrong in our body disappears. And that's the biggest thing that our clients tell us when we talk to them like that. That we explain them the why and the root causes. And then they say, oh my God, this feels so good that I know finally what's happening in our body. Why is it happening? And what's the self-healing process? What do I still have to go through potentially until my body has completely healed? It's kind of almost predicting symptoms that are going to happen in the future. So thank you so much. I really, really appreciate it for you staying with me here in the webinar. And I hope I could show you the power of lifestyle prescriptions and root cause analysis and the art and science of self-healing, and how valuable it is for you, how much more precise you're going to find root causes, and being able to answer these vital questions with clients, and especially how your results going to go through the roof, how your confidence goes up tremendously. So click this link here on the right side. There is a button there in the chat box, a link that you can click. It opens up the order form. And again, you can choose between the one-time payment of the 997 here, or a payment plan $299 times 4 months. You own the class, it's unlimited access, it's live, it's practice, and you're gonna learn how to do this for yourself and for your clients. And you get these amazing charts also by mail. Thank you again. It's wonderful to have you, for you to be part of our Lifestyle Prescriptions University community, our tribe. This is very passionate about making a difference and creating leaders in this new healthcare paradigm. So click the link, and I'll see you probably in just a few minutes, right? I'll see you in a few minutes inside the foundation course, and for sure in the 3 months training with the live classes starting very soon. Again, this is very limited, right? We just have a few spots available, and this offer will go away in a few days, so make sure you take advantage right now, and no risk. You can try it for 7 days, okay? Thank you again. Really appreciate it, and I'll see you very soon. Thank you. Bye-bye.